822, Big 550, KTRS. Let's check in with Dr. Jeffrey Lowell. He is professor of surgery and pediatrics at Washington University. Good morning, Dr. Lowell.
Good morning, Garth. Good morning, Kelly.
Yeah.
Good morning.
I'm not Garth, but I sure wouldn't mind being. I sure do like him. Let's get to this Ebola. Now with this second health worker diagnosed with Ebola, what are your thoughts as you sit and watch this?
First of all, this is incredibly uncommon and unlikely to happen to anyone in the United States. Flu is much more likely to happen, so get a flu shot. Now that being said, this is a big challenge because healthcare workers, providers, nurses, technicians, for the most part, are trained and excellent at providing healthcare. They're not trained to provide hazmat capabilities. And so this is a situation that requires both, because when someone is sick with Ebola, they've got 10 billion viral particles in a fifth of a teaspoon of blood, which is a lot of viruses compared to even HIV or compared to hepatitis C. So that the preparation and the conduct of business, taking care of somebody who's sick, has to be in some form of hazmat suit, which is more than the normal personal protective stuff that we wear when we take care of people in a hospital, and it requires training, and you should probably also have demonstrated competencies to do this. And I think there's been a poll that's been taken nationally amongst nurses who feel that they haven't been trained and given proper equipment and demonstrated competency to provide this level of care and this level of personal protective equipment. And I think if you gave the same poll to doctors and other people involved, they'd probably say the same thing, because we're not trained to do this, and we're not equipped to do this type of care. And so it is specialized. It's fortunately very, very, very uncommon here in the United States, being one or two or three, as opposed to West Africa, where there's thousands. So I think some serious consideration needs to be given to making sure that there's experts that are involved in taking care of these rare people that have this type of infectious disease, and that either means bringing a specialized team to the patient or moving the patient to specialized teams.
What I find interesting about all of this is you've been on the show numerous times talking about how in West Africa they just are devoid of any type of first world medical facilities and doctors and gloves and all that type of stuff. Well, we have all of that, and we're still having a hard time containing it.
I'd say we're doing a pretty good job containing it.
No, I understand.
It will. I mean, this will for sure be contained in the United States, for sure. But what we don't have, and what they don't have in West Africa too, is the capabilities and training and equipment for the hazmat part of this. And this is a big hazmat stuff, both in terms of transmitting it from person to person as well as cleaning up the potentially contaminated areas. And we don't do this well in hospitals. And that's because this is outside of our core expertise.
We're now hearing that the patients that are surviving are donating their blood or their plasma to the patients that are still suffering. Is that doing any good?
Don't know. This is all experimental. This was a part of that the drug that was formed, that was being given and tested in West Africa, and also I think the doctor in Atlanta got it as well too, DMAC. So it's possible. It makes sense. If you survive, you're likely to develop antibodies against virus, and maybe that will lead to a vaccine one day. But this is, I would say, very experimental.
And you were saying vaccine. Weren't they working on something to try a vaccine?
Well, I'm sure there's a lot of interest in it right now, but I mean, everything. This is very, very, very early days. I mean, while Ebola has been around for a while in West Africa, it really has not left the confines of West Africa. And this is the first time that I think most Westerners or Western Europeaners or Eastern Europeaners have really paid a significant amount of attention.
When you say a hazmat suit, I mean, there's gloves and there's gowns and there's hats and there's masks, but there's a difference between that and, say, a full-fledged hazmat suit?
Yes, and there's different levels of whether you need to have air protection or particle protection, and how you put it on, how you take it off, because it can be very tricky to you can protect yourself while you're in it, while you're in a room or taking care of somebody, but actually taking it off, you can contaminate yourself during the process of taking it off. So there's good training on this. You need to be trained to do it, and it's stuff we can simulate. Also, there's also stuff out there where you can practice and see how well you are doing in terms of keeping. I'll use the word slime, for example, that has some ultraviolet capabilities. So you can't see it when you put it in a room, and then you can use an ultraviolet light and see if you've actually spread it or got it on yourself.
So the fact that this Texas Presbyterian Hospital wasn't equipped for Ebola, now they're saying they should have sent these patients to Emory or to Omaha. They should then send these current patients to Emory or Omaha, right?
I think it's a reasonable thing to think about. I mean, I think the expertise in the average community hospital, which is almost 99.9% of hospitals, or even big university hospitals, aren't set up to deal with this level of protection for both patients, other people that are working in there, and providers. So I think, and the people at Emory, with these BSL-4 hospital rooms, they train on this all the time. They're really good at it. They practice it. This is not something that a normal hospital would practice. Not this level. We practice against people who have bacteria that may have drug resistance or may have a respiratory infection, but not this level of a virus where this many particles. And the risks are so high.
Yeah, our nation's airports, at least 5 of them now, are taking people's temperatures, as they come back into this country. Do you think that's a good, effective way of trying to?
No, not really.
Catch it?
I don't think there's probably downside other than there's going to be longer lines. But with these systems that are self-reported. They're not very reliable, and not all these airports are taking people's temperatures, and even that is pretty unreliable too.
Right, just because you have a higher temperature doesn't really mean anything. Right. What about these nurses that are saying, "Hey, we weren't following protocols, the hallways weren't cleaned"? Are you expecting that maybe another 1 or 2 or 3 healthcare workers in Dallas might come down with Ebola?
Definitely possible.
Yeah.
But I think until we kind of figure out that we need to have expert training and equipment to manage this current situation. There could be more.
Dr. Jeffrey Lowell, professor of surgery and pediatrics at Washington University. He's the best, and he's ours, and we have him every week. Doctor, be safe out there. Thanks for the insight. We'll talk to you next Wednesday.
Take care, McGraw. Bye, Kelly.
All right, 8:30 here, Big Five.